Welcome to our channel. Today, we're diving into a critical diagnostic test known as the Hereditary Angioedema Screening Panel Serum test. This test is crucial for diagnosing a rare but serious condition called hereditary angioedema, or HAE. Pre-test information. Before we delve into the specifics of the test, here's what you need to know before taking it. Overnight fasting is preferred for accurate results. This means you should refrain from eating for at least 8 to 12 hours prior to your test. It's also important to inform your healthcare provider about any medications you are taking, as some medications might interfere with the test results. Specification of test. Now, let's talk about what this test is all about. The Hereditary Angioedema Screening Panel Serum test is designed to diagnose hereditary angioedema, a genetic condition that causes episodes of severe swelling. It checks for abnormalities in certain proteins that are involved in controlling inflammation. This panel primarily measures two key components: C1 Esterase Inhibitor. This protein plays a critical role in regulating the complement and contact systems of inflammation. Low levels of C1 are associated with hereditary angioedema. C4 concentration. Complement component C4 is also measured, as low levels can indicate the activation of the complement system in HAE. Disease-associated. Hereditary angioedema, or HAE, is characterized by episodes of swelling that can affect the skin, intestines, and airways. This condition is not associated with hives or itching, but it can be very painful and, in some cases, life-threatening. The first signs of hereditary angioedema typically appear in childhood or adolescence. Symptoms can include recurrent episodes of edema in various parts of the body, such as the hands, feet, face, or genitals. Abdominal pain caused by swelling in the gastrointestinal tract. Potentially life-threatening swelling in the throat, which can obstruct breathing. Specimen used. For this test, a sample of your blood will be collected. Blood is drawn from a vein in your arm using a needle. This sample is then sent to a laboratory for analysis. Components include the Hereditary Angioedema Screening Panel Serum test typically includes measurements of C1 Esterase Inhibitor levels. Low levels of C1 are a hallmark of hereditary angioedema. C4 concentration. Low C4 levels indicate the activation of the complement system, which is characteristic of HAE. These components are crucial for diagnosing HAE, as low levels of C1 Esterase Inhibitor and C4 can support the diagnosis. Test report time. After your blood is drawn, the results of the test usually take a few days to process. Your healthcare provider will receive the report and discuss the results with you. It's important to follow up with your doctor to understand what your results mean for your health. Test information. Here's some important information about the Hereditary Angioedema Screening Panel Serum test. Hereditary angioedema is an autosomal dominant condition, meaning it can be inherited from a parent who has the gene mutation. The test has a high specificity of 98% towards detecting C1 deficiency, which is a key indicator of HAE. In about 15% of cases, the levels of C1 Esterase Inhibitor may appear normal or even elevated. In such cases, a C1 Esterase Inhibitor Functional assay may be necessary to confirm the diagnosis. Clinical implications. The results of the Hereditary Angioedema Screening Panel Serum test can have significant clinical implications. Early diagnosis and treatment are crucial for managing HAE and preventing severe complications. Treatment options may include medications to prevent swelling episodes and emergency medications to treat acute attacks. That's all for today's video on the Hereditary Angioedema Screening Panel Serum test. If you found this information helpful, don't forget to like, subscribe, and click the bell icon for more health-related content.